Diabetes can ravage the body. It can affect everything from your heart to your eyes. But did you know it can also affect your hearing too? To explain, we're joined by audiologist Dr. Gnewikow, and I didn't know this. How does it affect our hearing?
In one of our other sessions, we use the word comorbidity. That's when two medical issues can exist simultaneously and can be related to each other. And there is a comorbidity between hearing loss and diabetes. The American Diabetes Association in 2015 found that there are about 30 million Americans that have diabetes. That's like 9% of the population at that time.
Mm-hmm.
So it's really a big issue. The issues with diabetes are basically twofold. One is diabetes affects blood flow. It affects the vessels. And the inner ear is very sensitive to blood flow. So if the vessels transmitting the blood and the oxygen, the nutrients to the inner ear is being hampered in any way, then those little nerve endings can be damaged or even die. Mm-hmm. Another issue with diabetes is neuropathy. People have neuropathies in their hands and their feet, and that's a very common finding. Well, with the auditory system, the cochlea, or the inner ear, is basically the microphone that's picking up the vibrations of the eardrum, but it's got to get to the brain somehow, and so that is through the eighth cranial nerve, the auditory nerve, kind of like the wire from a microphone that transmits the information. But there is a entity called auditory neuropathy, which means the auditory nerve is not transmitting those neural pulses the way that it needs to be because of some degeneration. The incidence of auditory neuropathy is higher in diabetes than non-diabetic patients. Hearing loss in general is about twice as predominant in the diabetic population as the normal population. Wow. Not only hearing loss, but you also have tinnitus, you know, the little ringing in your ears. So all of those things are issues. If you know you have diabetes, it would probably be a good idea to see your audiologist and get a baseline on your hearing, because as time goes on, as the diabetes progresses, you may have further deterioration of your hearing, and you always want to know how fast is it going. Mm-hmm. So getting a baseline is really a good idea. And just like cardiovascular issues, sometimes the ears can be a window into the body telling you about other things that may be not up to par, kind of like a red flag. So if you are having changes in your hearing and nothing else is wrong and there is no obvious reason for it, you might want to have your family physician check out issues like cardiovascular issues and like diabetes. You may have a form of diabetes and not even be aware of it yet. So sometimes your hearing can give you information other than communication.
Very good point. And to find out more about hearing loss or to be tested, give the folks at Audiology Hearing Aid Associates a call. In Lynchburg, they can be reached at 434-528-4245, or in Danville, give them a ring at 434-799-6288. You can also find out more online at digitalhearingforyou.com.